Welcome, welcome, welcome to week 3, everybody. I'm Mrs. J, the curriculum director here at AMCI. And I just am, I'm very, very excited about week 3. I'm very excited that you're here. Let me go ahead and introduce my team. Say hello to the instructors. Instructors, please wave, wave, wave in the chat. They are the most amazing instructors on the planet. They can rock any guideline, clarify most confusion, and uplift any student at the same time. And they do it with skill and heart. And I am telling you the truth. Say hello to the instructors. And let's not forget about the backbone of AMCI, our incredible interns. They are the quiet force making everything run behind the scenes, and they wear the blue badges. And I'm not going to forget about you, coders. You are an integral part of this experience, and together with you, we're building greatness. So let's go ahead and crush week 3 neoplasm guidelines. Let's do it the AMCI way. And we're going to begin with some questions, commonly asked questions from last week. And they are how to get started. Why do I need medical coding? Introduction to medical coding. Why do I have to satisfy those prerequisites? Why do we have to study like this? Can't we just exam prep? Number 4, do I have to join Discord? And number 5, how do I join the Discord? Okay, all right, so I'm going to answer them as quickly as I can because we've got a lot to unpack today. All right, why do I need medical introduction to medical coding? Why do I need to fulfill those prerequisites? Because this course is designed under the assumption that you have that base, that you understand general coding guidelines and conventions. So you have to understand that before you can have a conversation on specific coding guidelines. And that's what the first 8 weeks is all about. So go ahead, click on the link. It's in the chat. We're putting it in the chat for you. If this is too heavy and you need those prerequisites, go there first. If this is your first time here, you have to click on the prerequisites for this to make sense. All right? Okay. Number 2, why can't we just exam prep? Why do we have to do all this studying? Well, because it's essential. It really is. That is the problem. If you see people on social media saying, I can't find a job, I can't find a job, it's likely because they can't pass the pre-hire exams. And those exams require that you have fundamental skill. And you got to know those guidelines. You have to know how to code. So we're showing you what you need. And at the same time, this is what you need for the exam. This makes you a strong coder, right? And besides, what about AI? You hear people saying, well, AI is taking my jobs. No, they're not. Right now, there is a strong need for people who can oversee AI. Yes, AI can do the small stuff, but AI, when it kicks it out, it's going to need someone to kick it out to. And you, the person who has a strong guideline knowledge and the ability to reference guidelines, that's going to be you, and it's going to put you at an advantage. We're just getting ahead of the horse, right? So make sure that you know your stuff and you will do well on those pre-hire exams. You'll do well on your exam. Okay, I know I said I was going to be quick, but Do I have to join the Discord? No, you do not. You do not have to join the Discord. The people in the Discord, they get to communicate with one another. They do get some resources, such as handouts for this playback from tonight and today. And they also get some extra practice questions, and some of them get to have questions answered by their instructors. And they also peer, they study together in the Discord. So there are some advantages, but no, you do not have to join the Discord. We've put enough to do well in this course on your syllabus. Follow your syllabus and you're good. Now, the next question is, how do I join the Discord? Well, how to join Discord? Well, log on to our YouTube channel and click join. And don't forget to link to your YouTube channel to Discord. It's going to ask you after you choose join and you do whatever you need to do, it's going to ask you to link your YouTube channel to Discord. So make sure that you do that so that you can get the resources that you need. Or you can just click the link that's in the chat. We're putting it in the chat. You can go ahead and join by clicking the link. Now, on to the good stuff. These are the texts that you need or required for the first 8 weeks. We are in week 3. You need your ICD-10-CM, your Bucks step by step, and your MCG manual. You can use any year between 2023 and 2025 for your Bucks step by step, and for the MCG, 24 or 25. Okay, now let's read the copyright. Copyright. CPT is copyright of the AMA. All rights are reserved. Keyword concept FTR Chun, AMCI Fab 7, AMCI ICD-10-CM Flip Tap, and MCG are trademarks of AMCI. CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by AAPC. CCA, CCS, CCS-P, RHIA, RHIT are owned by AHIMA, and AMCI does not own the rights to these credentials. Goals of the presentation. Number 1, we're going to review Section 1, Chapter 2 Guidelines, Neoplasms. Number 2, we're going to test your knowledge with practice exercises. And 3, we're going to bring you one step closer to guideline mastery. Now let's go ahead and begin our discussion on ICD-10-CM Chapter 2 Specific Coding Guidelines for Neoplasms. Now, if you didn't know that specific coding guidelines, these are Chapter 1 C guidelines. These guidelines take precedence over the conventions A guidelines and general coding guidelines B guidelines. I just thought I would say that. Now let's get started. Essentially, in this section, you are coding for neoplasms, cancers, sarcomas, adenomas, and leukemias, just to name a few. But before we go any further, let's look at the classifications or types of neoplasms as defined by ICD-10-CM. Let's begin defining these types of neoplasms. First, you have benign. Benign neoplasm is a non-cancerous tumor and it doesn't invade nearby tissue or spread to other parts of the body. Cancer in situ. Now, this is a malignancy. This is cancer often, and it remains confined to its original site. One thing about cancer, cancer spreads. Cancer in situ does not. Often, this is very early stage cancer or pre-cancer. Primary malignancy, this is indeed cancer. It is the original site where cancer begins before it spreads, and this is the first cancer diagnosed. Next, we have secondary cancer, secondary malignancy, and this is metastasis. It's also known as metastasis. And this is cancer that has spread from the primary site. So it spreads from another part of the body to that site. And finally, we have uncertain and unspecified cancer. Now, uncertain is pretty much what it says. The doctor's not certain about the type of cancer, and unspecified, the doctor didn't specify the type of cancer. Let's quickly look at my image of a prostate, or my images of a prostate. The first one represents a normal prostate with normal prostate cells. They call them epithelial cells. And they line the prostate, you see there within the cell. Now, when we get to the second image, this can be in situ, right? So you've got normal cells, but also you see some low-grade precancerous um, activity, but it's still confined to the prostate. The cancer has not moved. So we often call this precancerous because it's low grade. Now, the next image, this is definitely primary cancer. You see the epithelial cells kind of moved from the cell and start to form a tumor. And this is about maybe stage 2 and 3 cancer of the prostate. Then we move to primary invasive or metastatic cancer. This is what this image is representing. That tumor is kind of losing form, and those cells are migrating to tissue in the area, other tissue in the area in the same body system. And this is primary invasive or metastatic cancer. And then it becomes secondary when it migrates over to the bone. And this is metastasized. This cancer has metastasized. All right, so I do want you to know the difference between metastatic and metastasized. Metastatic is the primary source, and ick, if you learn medical terminology, means pertaining to. So this is pertaining or pertinent to the primary cancer, and metastasized means that it has moved on to another area, and this is secondary cancer. And here are the guidelines from the perspective of the MCG manual. And remember, in the middle, the part that's unshaded, these are the actual CMS guidelines from the CMS document, word for word, or they should be. Okay, just want to point out that the guidelines also define these classifications because there is a neoplasms table located in the alphabetic index. And you, according to this guideline, are directed to go to the neoplasms first when coding for neoplasms. Now let's go ahead and explore the neoplasms table. When coding for neoplasms, there are 3 things to remember. Step 1, go directly to the neoplasms table. The neoplasms table or neoplasm table is located in the alphabetic index. Yes, it is a table. Also, you're going to remember that histological terms are not coded from the neoplasm table. And step 3, or remember, to verify in the tabular list. So after you've looked your code up in the neoplasm table, verify it in the tabular list. And remember, you code neoplasms from the neoplasm table, except if if it's a histological term, and we will discuss histological terms very shortly, but I want to demonstrate how to look up a code in the alphabetic index neoplasm table. Let's take a look at the alphabetic indexes neoplasm table. Remember, these neoplasm tables have to be researched or looked up first for neoplasms, and they are arranged alphabetically. So if you're looking for, let me get my pointer. So any neoplasm that you're looking for will appear here. And so you've got two columns. And these columns are broken down according to the types of cancer. You have malignant, primary, cancer in situ, benign, uncertain behavior, and unspecified behavior. And the same is over here. Now, if you're looking for a particular cancer, let's say kidney cancer, what are we going to do? We're going to search alphabetically under the K's for kidney, right? And if you do that, you'll see that kidney is not there. So what do? Well, let's think about the clinical term for kidney, and that's renal. And of course, it is there. So we're going to look up renal in alphabetical order, and here it is. Next, what type of renal cancer? Well, let's say it's primary cancer. Then we're going to go to the primary column, and then we're going to scroll down until we get to renal. There you go. And then it directs us to use C64 category. And also we see at a glance that there are some additional characters needed. So the next step is to verify it in the tabular list. And if you go to the tabular list under C64 malignant neoplasm of kidney except renal pelvis, this is our category, and underneath they are arranged according to the side of the body laterality. Is it right, left, or unspecified? Ours is not specified, so our code would be C64.9. Now, how do you know that you're supposed to do this? How do you know, Mrs. J, that you're supposed to look up a neoplasm in the neoplasm table and not the alphabetic index? Well, this guideline, section 1, C2, the very first guideline says it. Let me get my pointer. It says that first you sequence your neoplasm table for a neoplasm. Second, if it's not there, look it up in the alphabetic index. And that guidance is written right here. All right, so it tells you how to sequence, and that's what you do. Now, I said that if it's a histological term, that you won't look it up in the alphabetic indexes neoplasm table. No, you would go directly to the alphabetic index. But first, let's look at what a histological term is. And a histological term basically clarifies or includes cellular characteristics of a tumor. In fact, it further specifies if the cancer is benign, in situ, malignant, etc. It'll go beyond that classification. So let's take a look at these histological terms. If we start with adenocarcinoma, this is cancer of glandular tissue. So it's specifying not only the type of cancer, but where it is on the body. Squamous cell carcinoma. This is cancer of the squamous epithelial cell. Sarcoma is cancer of connective tissue like muscle, bone, and fat. Melanoma, cancer of the melanocytes. This is pretty much skin cancer. Glioblastoma is malignant brain tumor derived from the glia cells. Lymphoma, cancer of lymphatic system cells. Leukemia, this is malignancy of blood forming tissues. Papilloma, benign epithelial tumor, and it's a wart like shape. Lipoma is benign fatty tumor. And chondrosarcoma, this is malignant tumor of cartilage. So these histological terms further specify the type and location of the cancer. And most important, the rule of the omas. AMCI calls it the rule of the omas. If it's a oma, likely you have to look this term up first in the alphabetic index. Don't go directly to the neoplasm table. All right, so there is one that's not a oma, and it is leukemia, but you get the picture. All right, let's move on and let's review key guidelines for Chapter 2. This begins our study of ICD-10-CM specific coding guidelines for neoplasms. So these guidelines are from Section 1, Chapter 2, Neoplasms of ICD-10-CM. Let's begin with when a patient is admitted for treatment of primary cancer. This is what you do. You're going to follow guideline IC2A, and this guideline says, number one, you're going to code first your primary malignancy. And there is an exception. If the reason for the encounter is for chemo, immunotherapy, or radiotherapy, or radiation therapy, you're going to sequence the encounter code first, and it's from the Z51 category. Now, it's important that when the reason for the encounter isn't specified, you're going to sequence the primary cancer first. Got it? Now let's review admission for treatment of secondary cancer. And when the cancer traveled from the primary site to the secondary site, and if you look at this image, the primary cancer was here on the kidneys and it traveled to the lung. So this will be the secondary cancer. You're going to reference guideline IC2B, and this guideline tells you to do the following. When the treatment is directed at secondary cancer, you're going to sequence first that secondary malignancy is primary, and then second, you're going to sequence the primary malignancy if the patient still has the primary cancer. And then in that case, you would use a history of malignancy code. And remember, pay attention to the reason for the encounter. The documentation will tell you what or which cancer is being treated. And I don't know if you're like me, but I always wondered, how do physicians know where the secondary cancer traveled from? Sometimes they can diagnose secondary cancer without even knowing where the primary cancer is. Well, pathologists will see the cells in that secondary cancer. So if the cancer traveled from the kidney per se, and the patient has kidney cells in the lung, then that is how they know that it is secondary cancer. All right, I digress. I do have a tip for you. All right, so here's a tip that I tell my students, my MCDC students. It's important to recognize these codes on site. Not all of them, but the code series. If you see C00 through C76 on site, my students know that this is primary cancer on site because they've learned it. And you all may have too if you've watched part 3 or 4 of the beginner's lectures. Now we know this is primary malignancy, and we also know on site that C77 through C79, this is secondary cancer, right? Yeah. So if you recognize it on site when you're taking a multiple choice exam, that is priceless. I don't ask you to remember too much, but this is one thing that I think you should remember. And when you're practicing today, it's going to really help you. It's going to cut down on time tremendously. It's a huge fact to remember or tip. Make sure you employ it. And also, don't forget, sequencing priority will depend largely on the malignancy that's being treated. All right, let's get back to these guidelines. Sometimes cancer patients develop anemia, and this could make their red blood count compromised or low. And when that happens, they come in for treatment. Treatments like iron therapy or even blood transfusions. When that's the case, you're going to reference guideline IC2C. And this guideline says you're going to sequence first your malignancy code, second, your anemia code, typically D630. And it's very important that you pay attention to the reason for the encounter because that encounter is for the management of the anemia only, not the malignancy. All right? Got it? How you doing, coders? I know I'm just shooting these guidelines at you. I'm moving a little faster than I usually because we got a lot of scenarios to do. All right. So hopefully you got that. Type in the chat. Let me know how you're doing. Okay, we've got another guideline, and some people kind of confuse them. So let's take a look. When the chemo causes the anemia, very important. It's different than when the cancer or the malignancy causes the anemia. So make sure you pay attention and grab the correct code. And this is guideline IC2C2. When the chemo causes the anemia and the treatment is directed at the anemia, you're going to sequence first your anemia related code, second, your malignancy, and third, your complication code T45.1X5 with the correct seventh character. Make sure that you select the seventh character extender. Also, pay attention because the treatment must only be for the management of the anemia. And how they manage that anemia? Well, yes, iron therapy, blood transfusions, and erythropoiesis, stimulating agents or ESAs. That's when they take the bone marrow to produce more red blood cells. So these are treatments that you'll find in your documentation that will give you an idea that the treatment is directed at the anemia. Now we have another complication. And this complication is some patients develop dehydration due to malignancy as well. And we're going to reference guideline IC2C3. And this guideline says when dehydration is due to the malignancy, you're going to sequence first dehydration, second, the malignancy. And remember, apply the guideline when dehydration is only being treated. So you're going to see in the documentation maybe rehydration treatment. That's very common. All right, coders, let's continue. I believe this is our final guideline. And this is when the encounter is for chemotherapy. immunotherapy, and radiation or radiation therapy. So if the patient came into that facility for chemo, you're going to reference IC2E2. And this guideline says when a patient comes in for any of these therapies, you're going to sequence first that encounter code from category Z51 from that category. Second, you're going to sequence the malignancy code. And remember, pay attention to the reason for the encounter. You're going to see documentation with several things going on, but make sure that you hone in and focus on that reason for the encounter. And if that patient came in for a chemo, radiation, or immunotherapy, often that's your first listed code. And this guidance says if more than one therapy is administered during that encounter, like right here, let me get my pointer. Um, you can use multiple encounter codes. So chemo has its own encounter, immuno and radiation also have their own encounter codes. And coders, how are you? How you doing? All right, it's time to solve scenarios. And from this point on, we will be solving scenarios. And I encourage you, if you have your MCG manual, pull it out because you're going to need to reference and abstract the guideline. Also, if you don't have the MCG manual, I would get the CMS um, guidelines and chat team, if you can put the CMS guidelines in the chat so they can grab them and go to section 1, chapter 2, neoplasms, and search for the guidelines as we go. All right, let's do it, coders. You can and you will. Let's do it. Very quickly, let's review how to solve an ICD-10-CM scenario the AMCI way. Number 1, inventory. Inventory all signs, symptoms, and diagnoses and diseases. Number 2, select your first listed code. Number 3, apply all guidelines. And remember, coders, remember to trust the guidelines. This exam, a large portion of your medical coding certification exam, is measuring your ability to recognize and apply guidelines. So this is where we're practicing. So go ahead, get your guidelines. If you want to use the CMS guidelines, they are in the chat. Also, if you want to use the guidelines in your ICD-10-CM manual, the index or the tabular list, you can find them there, and you can also find them in the MCG manual. Okay, so now to break things up, I'm going to bring in my lead instructor, Ms. Dolly. And I just want to say thank you in advance, Miss Dolly. Take it away.
Of the following answers, what is the correct code selection? A. C04.9, B. C02.9, C. C14.8, or D. C04.9, C02.9. A 67-year-old female patient presents with a malignant neoplasm that extends across the floor of the mouth and the anterior two-thirds of the tongue. Both sites are documented as primary sites in the pathology report. Of the following answers, what is the correct code selection? Okay, coders, you have 60 seconds. Good luck.
Okay, coders, how did you do? Did you apply the guideline? Did you use your guidelines? I hope you did because it will help. All right, let me show you how I solved. First things first, I'm inventorying my key terms: malignant neoplasm, and the location of that neoplasm extends across the floor of the mouth. Also, the anterior two-thirds of the tongue. And it says both of these sites are primary. So my keywords, my inventory is in blue, but I want to show you something. I want to show you where the floor of the mouth is. A lot of you already know that it's underneath the tongue, and also the anterior part is above the tongue. So both of these locations, they're not the same. We see that, and they are two distinct locations. But one thing I notice, they are contiguous. In other words, they're next to each other. And there's a guideline for that. So if we go and reference the guideline, you can find it at IC2. It's at the middle of the page. If you have an MCG manual, it looks like this. And this guideline says when you have primary malignant neoplasms overlapping site boundaries, then you use point 8 for overlapping lesions unless a specific combination is indexed. And it also says assign separate codes for non-contiguous neoplasms. And if you didn't know, well, I just said it, that, well, no, I didn't. Contiguous is when they are overlapping. Yeah. How do you know, Mrs. J? Well, I didn't know until, I looked it up. So let's go ahead and look up these codes. Let's start with C04. This is the code for malignant neoplasm of floor of mouth. All right, so we would use this for the floor of the mouth. 602.9 is malignant neoplasm of tongue unspecified. We definitely aren't going to use that because our condition is specified. Our location is specified. Our location on the tongue is specified. It's the anterior two-thirds of the tongue and the floor of the mouth. And C04.9 is floor of mouth unspecified. So both of these point 0.9 codes are unspecified codes, and they're not going to work because our location is specified. So that leaves us with D, C04.9, and CZ and C02.9, same thing together. Well, A and B are wrong because they weren't coding for enough tongue, and D is coding for the wrong part of the tongue, and C is correct, our correct answer. But let's look at C. Let's review this code. It says malignant neoplasm of overlapping sites of lip, oral cavity, and pharynx. So the tongue and the mouth are part of the oral cavity, but it is this language down here, the supplemental language that says primary malignant neoplasms of two or more contiguous sites of the lip, oral cavity, and pharynx. Now, the key term is contiguous. It means next to each other. In other words, it's overlapping sites. So these contiguous sites are also overlapping sites. And when you have overlapping or contiguous sites, you must use C14.8. So you don't need to code both. And that is how we got our answer. And if you had an aha moment, type those ahas in the chat. Aha! But if you got it correct, that's outstanding. Okay, coder, so the answer is C. And now it's time for Miss Dolly. Please and thank you.
Of the following answers, which best describes the encounter? A. C50.412, B. C50.312, C. C50.812, or D. C50.412, C50.312. A 45-year-old female presents with malignant neoplasms in the upper outer and lower inner quadrants of the left breast, confirmed by a biopsy as two distinct primary sites. The physician documents both masses as separate primary malignancies. The neoplasms are not touching or overlapping. Of the following answers, which best describes the encounter? Okay, you have 60 seconds to solve, coders. Good luck.
Okay, so how did you do, coders? All right, I know you did good. I know it. Okay, so here are my key terms. Neoplasms in the upper outer quadrant of the breast, of the left breast. And also, those neoplasms are present in the lower inner quadrants of the breast. And the provider says that these are two distinct primary cancers, and these neoplasms are not touching or overlapping. All right. So that kind of makes, let's get a visual for this, right? So each breast has four quadrants. And if we start here, this is the upper outer, lower inner, lower outer, lower inner, and upper inner. So if we look at our documentation, it says that the patient has neoplasms in the upper outer left breast. So let's go ahead and mark that off. It also says that there are neoplasms in the lower inner quadrant of this left breast, and it's here. And of course, it says that these are both two primary sites but they are not touching or overlapping. In fact, they are non-contiguous. I'm going to let that marinate, right? So remember, each breast has four quadrants. And when they describe the location of the neoplasms, this is how it's done. Okay, coders, let's go ahead and solve this scenario. And the guideline that we're going to use is the same guideline that we used for the previous scenario, IC2. And if you can recall, we are to use point 8 for overlapping lesions. However, it tells you to assign separate codes for non-contiguous neoplasms. So we've already established that these are non-contiguous. If you look up here, number 4, these are non-contiguous and on-site coders. On-site. D should be the answer, right? Okay, let's do our due diligence. But first, I want to show you this little thing that I do. See this little plus? Whenever I take an exam and I have breast procedures, just so I can stay focused, sometimes I will draw this little image and I'll draw a plus sign to represent four quadrants, right? So you have the upper outer and lower inner. So if you want to do it, if you feel you need to, go ahead. That's just a little tip. Now let's go ahead and look at these codes. C50.4, this is malignant neoplasms of the upper outer quadrant of breast. Subcategory C50.3, this is the malignant neoplasms of lower inner quadrant of breast. Subcategory, so they are the correct subcategories. And then we have C50.8. This is malignant neoplasms of overlapping sites. As you can see, they don't overlap, and neither does the documentation. It tells you it does not overlap. So we know we're going to get rid of C right away. Gotta go. It's a distraction. And we're also going to get rid of B because it's not coding for um, the upper outer quadrant of the breast. And we're going to get rid of A because it's not coding for the lower inner quadrant part of the breast. And D is coding for both. And specifically, it's coding C50.4, malignant neoplasms of the upper outer quadrant of left female breast, and C50.3, malignant neoplasms of the lower inner quadrant of left female breast. Encoders, if you said D, way to go, way to go, way to go. But, coders, if you learned something, remember it is priceless. It is. Okay, we got another scenario. Take it away, Miss Dolly. Please and thank you.
Of the following answers, which best describes the encounter? A. C3 4.11, C7 8.7, B. C3 4.90, C. C7 8.7, C3 4.11, or D. C7 8.01. A 65-year-old male patient presents with complaints of persistent cough and unintentional weight loss. A CT scan of the chest reveals a mass in the right upper lobe of the lung. A biopsy confirms small cell carcinoma of the lung with additional imaging showing metastasis to the liver. The patient is referred to oncology for further management. Of the following answers, which best describes the encounter? Okay, coders, you'll have 60 seconds to solve, and your time will begin now. Good luck.
Thank you, Miss Dolly. Okay, coders, how did you do? All right, hopefully you got the same inventory. I have persistent cough, mass in the upper right upper lobe of the lung. I have small cell carcinoma of the lung. So it is that right upper lobe carcinoma, and we also have metastasis or secondary liver cancer. All right. So I'm going to use this chart. Yeah, I'm going to use my chief reason for the encounter chart because we have some signs and symptoms that are integral to a disease or diagnosis on this sheet, right? So I'm going to eliminate those signs and symptoms. We have persistent cough, weight loss, and lung mass. Yeah, I'm going to eliminate them because they are distractions for me. And also, it's a guideline. You can't code for it. How many of you remembered that? Go ahead, type in the chat. Let me know. Good deal. Okay, now let's go solve this scenario. Let's find that guideline. So we'll begin with our inventory at the top. Now, which guideline would we apply? If you said guideline section 1C2A, that to me is the best. Now, this guideline is no longer in ICD-10-CM. So if you're looking in a 2025, the CMS publication, if you're looking in your manuals, it's not there, but we at AMCI, we kept this guideline because it was pertinent last year and a lot of the exams are still honoring it. And a lot of real world providers are still honoring it as well as insurance companies. All right, so there was a guideline, specific guideline. It was found in this language that said when you have both primary and secondary, and there's no evidence or distinction between which one is primary, which one is the reason for the encounter, then your default is to the primary malignancy, right? Yeah. If you look at our documentation, it says that this patient came in with these symptoms. They had a CT scan. They saw the mass in the upper lobe. Then they had a biopsy, which confirmed cancer of the lung. But they also showed metastasis to the liver. Additional imaging showed metastasis to the liver. So there's no real um, or confirmation that the treatment was directed at primary or secondary. But I want you to know that the default shall be primary until specified, until otherwise specified. And that's what you're going to need to do for your exam. Okay, coders. Now, I gave you a tip earlier, right? Yeah, I told you that on site, primary malignancies are basically less than C76. So, and there's some after C79, but let's just focus on these. So the lower Cs and secondary cancers are between C77 and C79. So on site, you should be able to select the correct code if we are following this default that the primary malignancy is sequenced before secondary. I think what they want you to do is they're moving towards looking at the documentation and determining which one was chiefly treated. And we really can't tell. I know I can't, but if you can't tell, use this default. You can't go wrong. So, which on site is sequencing the primary lung cancer over the secondary or metastasis liver cancer? If you said A, outstanding. Hopefully, you use this and you understand that this is important. And you know what, coders? We didn't have to look up any codes. No. And the fewer codes you have to look up, time saved on the exam, it equals time saved. So hopefully you got that. And hopefully this tip helps you. And if you said a outstanding, if you had a aha moment, say aha in the chat. Go ahead and say aha. Okay, Miss Dolly, please and thank you.
Of the following answers, which best describes the encounter? A. C61, G89.3, C79.51. B. G89.3, C61, C79.51. C. C79.51, C61, G89.3. Or D. C61, C79.51, G89.29. A 62-year-old male with a history of metastatic prostate cancer presents to his oncologist complaining of severe bone pain due to known metastasis to the spine. The provider documents that the pain is directly related to the metastatic disease and prescribes opioid therapy for pain management. Of the following answers, which best describes the encounter? All right, you have 60 seconds, coders. Good luck.
Thank you, Miss Dolly. Coders, how did you do? Were you able to get the answer without looking in the ICD-10-CM manual? Okay, if you did, outstanding. This is how I solved this scenario. First, my key terms. My keywords are metastatic prostate cancer, severe bone pain, metastasis to the spine, and the provider documents that this pain is directly related to the metastatic disease. And also, I documented that the doctor prescribed opioids for pain management. And the reason I did is because when something is chiefly treated, it often confirms the principal diagnosis or the first listed diagnosis in this case. Okay, coders. So, according to this documentation, this number 4 has to be the first listed code. The pain is related to the metastatic disease. Okay, coders, what is the metastatic disease? If you said it's the prostate, outstanding. Remember, we said earlier, metastasis is the secondary cancer, and the metastatic represents the primary cancer after it has spread. So um, the we refer to the primary site as metastatic after it has spread. All right, coders, make sure you remember that. So prostate cancer will be our first listed code. And if you want to know how to recognize them, remember these code series that I've shown you earlier. C00 through C76. If it falls within this range, likely it's your primary diagnosis, your primary cancer. And if it falls between C77 and C79, it's often secondary cancer. So if we look at the answers, if the code falls between C00 and C76, we know that it's safe. But we see at C is falling under the C79.51. All right, coders, C79.51, we're going to eliminate that because we know it's sequenced wrong. It's sequencing the secondary or the metastasis before the primary cancer. Okay, coders, are you with me? All right, let's continue. And also, too, look at B. Before I move on, look at B. B is sequencing this G code first. And if you've studied the mnemonic terms or the categories, and you could do that in our prerequisites, we've shown you how to identify certain classifications of these ICD-10-CM codes on site. And I know that G category is nerve. What else is nerve? What else is in the nerve category? Pain, chronic pain. Just saying. All right. So I don't have enough to solve. So let's continue and let's go grab that guideline. Guideline IC2H. This guideline says when your admission or encounter is for pain control or management, you will need to sequence that neoplasm related pain first, followed by the neoplasm. And then it says C section IC6. IC6, well, this is the nervous system. And if you reference IC6B5, it says when your encounter is for control, pain control, sequence G89.3 or the reason for the encounter first, followed by your malignancy. If your encounter is for neoplasm management, you're going to sequence that malignancy first, followed by that pain code. So, our encounter, the reason for the encounter is to control pain, right? The documentation says the doctor prescribed these opioid therapy for pain management. And because the pain was chiefly treated, it is indeed the reason for the encounter. And the doctor says that the pain is related to the metastatic disease. Metastatic is your primary cancer after it has spread. So, therefore, the first listed code will be your pain code. And we get to eliminate A and C. And the correct answer is B. And if you said B, coders, outstanding. But if you learned something, that is priceless. Go ahead and say, aha, if you learned something. Go ahead and say, I did it if you solved this scenario without looking up the codes. Now, if you want to see the codes, here they are. All right. So, if you've been studying for a while and you're accustomed to using tricks to solve scenarios, those tricks wouldn't work here because you would have selected A or D. So, it's important that you learn these guidelines. You can and you will. Outstanding job, everyone. Okay, Miss Dolly, please and thank you.
All right, I'll start with the answer options. A, C34.90, C79.31, B, C79.31, C34.90, C, C79.31, Z85.118, or D, Z85.118, C79.31. A patient with known primary lung cancer is admitted for surgical resection of a solitary brain metastasis. The admission documentation indicates that the primary lung cancer is stable and no treatment was directed at the lung cancer during this admission. Okay, coders, you have 60 seconds to solve. Good luck.
Thank you, Miss Dolly. Okay, coders, how did you do? Do you feel good about this one? I'm pretty sure you do. Okay, this is how I solved. I selected primary lung cancer. This patient was admitted for surgical resection of a solitary brain metastasis. These are my key words, and I have to determine which is my first listed. And if you look at number 2, it says there was a resection of solitary brain metastasis. So metastasis is definitely my first listed code because it was the diagnosis that was chiefly treated, right? And what is the metastasis? Well, the brain cancer is your secondary cancer. And we reviewed previously that secondary malignancies are in this category range. So if we look at our answers, we can eliminate a couple of things. We can eliminate A and D because neither are sequencing C79, which falls in this category first. Now, let's continue solving. And we're going to use a guideline, IC2B. And this guideline says that when the admission is for the treatment of the secondary site, you're going to sequence the secondary cancer or malignancy first. We already knew that. Now, B and C, they're different because B is sequencing the primary cancer second, as well as C is sequencing some personal history of cancer second. And our guideline tells us, it says, hey, you're going to sequence the primary cancer second. So off bat, B is correct. On site, B is correct. But I want to give you another guide, another guideline. When you're coding for a personal history of cancer, and often that cancer has been previously excised, or there's no malignancy, or doesn't require any treatment, It has been totally eradicated from your body. That is when you use the Z85 category for neoplasms. So if that patient still has cancer, you do not use the Z85 category. Only use it when it's been completely eradicated. And on that note, B is our answer. And if you said B, outstanding, coders. Okay, coders, so I'm finished for now. I want to hand it over to our amazing Miss Bianca. She's also a lead instructor here at AMCI. Take it away, Miss Bianca.
Of course, Miss J. Okay, coders. What are the correct codes for this encounter? A. C16.9, D63.0, B. D63.0, C16.9, C. D64.9, C16.9, or D. D16.9, D64.9. A 72-year-old patient with known stomach cancer is admitted for treatment of severe anemia. The physician documents that the anemia is due to the malignancy. During this admission, the patient receives multiple blood transfusions and no treatment is directed at the stomach's cancer. You have 60 seconds to solve, and your time begins now. All right, let's work on solving this. So we have our inventory list. On mine, I put stomach cancer, severe anemia due to malignancy, multiple blood transfusions, and no treatment directed at the cancer. Okay, so now let's look at the guideline that helped us solve this scenario. So, Chapter 2, C1, which states when the RFE is only to manage anemia associated with the cancer, we sequence first the malignancy and second the anemia. And as you can see here, it tells us exactly what code to use for the anemia, the D63.0. So, based off of that, we are going to eliminate C because it is sequencing this D64.9, which isn't our anemia code, followed by the malignancy code. And we can also eliminate B because it's sequencing anemia first, then the malignancy. And we can eliminate D because it is sequencing the malignancy code first, but it's also sequencing this D64.9, which isn't a code we want, which leaves us with A, C16.9, D63.0. All right, coders, let's move on to the next one. Which is the correct ICD-10-CM code sequence for this episode of care? A, C34.32, Z51.11, B, Z51.11, C34.32, C, C34.32, D02.1, D, D02.1, Z51.11. A 63-year-old patient is admitted for a planned left lower lobectomy for primary lung cancer. And postoperatively, on day 3, the oncologist initiates the first round of adjuvant chemotherapy with carboplatin paclitaxel while the patient is still hospitalized. Pathology confirmed a 2.8 centimeter poorly differentiated squamous cell carcinoma of the left lower lobe with clear margins. The postoperative chest imaging shows no evidence of residual metastatic disease. You have 60 seconds to solve, and your time begins now. Okay, let's take a look at our inventory list. And I put left lower lobectomy for primary lung cancer. And post-op, day 3, had 1 round of chemo, 2.8 centimeter squamous cell carcinoma with clear margins, and no evidence of residual metastatic disease. Okay, so we have our smaller inventory list up top here for you guys to reference. And then the guideline that I used to help me solve this scenario was Chapter 2E. And this guideline states that you assign the appropriate encounter Z51 category code if the admission or encounter is involving chemotherapy. But when the encounter is for the administration of chemotherapy, immunotherapy, and radiation beam therapy. So this isn't the sole purpose of our encounter. The main purpose of our encounter is the lobectomy, and then they just received the chemotherapy. So we're going to sequence according to the RFE, which is the lobectomy. And so with that being said, we're going to get rid of B because it's sequencing this chemo code first. And we are also going to eliminate D because it has this D code here. And we have a primary lung cancer, so I know it's going to be a C code. It's not going to be a D code because this is typically the the codes for blood or diseases for the blood, and then neoplasms in situ or benign neoplasms and stuff like that are categorized in the D code. So I just know it's not going to be relevant to our case. And with that being said, I can also eliminate C because it also has that D code in there. It doesn't even mention our chemo. So that leaves us with A, which is C34.32, Z51.11. And if you notice, coders, we didn't even look up these codes. We just went based off of the guideline. And this clipping here is from our 2024 MCG manual, so it might look a little bit different from the 2025 if you guys have the 2025. But I hope you guys all got that correct. And hopefully you didn't have to look up the codes. But if you did, it's okay. Hopefully it led you in the right direction. But if you do look at these guidelines and kind of do a little bit of a process of elimination just based off of the knowledge that you have, you can sometimes pick out the answer. Not all the time, but sometimes. All right, let's move on to the next one. Which is the correct ICD-10-CM code sequence for this episode of care? A, C50.911, C73.3, Z51.0, B, Z51.0, C50.911, C77.3, C, C50.811, C77.3, Z51.0, D, C77.3, C50.911, Z51.0. A 45-year-old female with newly diagnosed right breast invasive ductal carcinoma is admitted for a right modified radical mastectomy with sentinel lymph node dissection. 2 out of 3 lymph nodes positive for metastatic disease. On postoperative day 4, while still hospitalized, radiation oncology begins targeted radiation therapy to the chest wall and regional lymph nodes. Post-mastectomy pathology confirms a 4.5 centimeter tumor with direct extension to the skin and positive lymph nodes. And imaging shows no distant metastasis. You have 60 seconds to solve, and your time begins now. Okay, let's take a look at our inventory list here. So I have right breast invasive ductal carcinoma, which is our primary neoplasm. And then we have the lymph nodes positive for Met's disease, which is going to be secondary to this breast cancer. Then we have a right modified radical mastectomy with centennial lymph node dissection. And then we have post-op radiation. So just to kind of simplify our list here, I'm just going to get rid of this procedure code. This would be, more for a procedure. And I would also like to remind you all that for our secondary cancers, our BOSS codes, or the three start of the category there, are typically going to be the C77, C78, and C79. So they're going to be like these higher sequencing numbers, as opposed to your primary codes are going to be a lower, like a C50. So just a little tidbit to help you all. Okay, so the guideline that I use to help me solve this scenario is very similar to the last one that we just did, and we honestly probably could have included it in that last scenario. They definitely complement one another. So it's chapter 2, E1, which tells us that when the encounter is for neoplasm surgery followed by chemo or radiation therapy, you are going to sequence first your malignancy and then second chemo or radiation therapy code. So with that being said, we are going to eliminate B because as you see here, it has that Z51 code listed first, followed by the malignancies, and this does not align with our guideline. So we are going to get rid of that. And now let's take a look at these codes here. So we have C77.3, secondary and unspecified malignant neoplasm of axilla and upper limb lymph nodes. This is definitely in line with what we have going on here. So we are going to keep all the options with this code here. But we do eliminate D because as you can see, this is secondary and this D option is listing the secondary first. And as we can see up here, radiation oncology begins targeted radiation therapy to the chest wall and regional lymph nodes. So that means that they're treating both sites. So with treating both sites, we're going to list the primary first, not the secondary first. So that's why we're getting rid of D here. And so now let's look at the C50.811 code that's here listed in option C. And this is malignant neoplasm of overlapping sites of the right female breast. And if you look in our encounter here, coders, we don't have any mention of overlapping sites. So we don't like this code. We don't like C. We're going to get rid of it. And that just leaves us with A. But let's still take a look at this C50 code just to kind of solidify what I was telling you guys before about the secondary and primary sites and how you can kind of tell at least what's secondary and what's primary just based off of the sequencing order of the numbers. So we have the C50.911, which is malignant neoplasm of unspecified site of the right female breast. This is definitely more in line with what we have going on here. And so we are going to keep the C50.911, C73.3, Z51.0, because this is sequencing primary, secondary, and then now the chemo code. And so we like this answer. We're going to keep it. And I hope that makes sense. And hopefully these little tidbits kind of help you all a little bit. And let's move on to the next one. Okay. Which is the correct ICD-10-CM code sequence? A, Z51.11, E86.0, R11.2, C18.9, C78.7, B, E86.0, R11.2, Z51.11, C18.9, C78.7, C, C18.9, C78.7, Z51.11, E86.0, R11.2, or D, E86.0, Z51.11, C78.8, C78.7, C18.9, R11.2. A 71-year-old patient with metastatic colon cancer to the liver is admitted for scheduled full FOX chemotherapy, but during treatment develops severe intractable nausea vomiting leading to acute dehydration, requiring IV fluid replacement and continuous ondansetron infusion. The patient's baseline labs were normal at admission, but after developing these complications show sodium levels at 150 and potassium at 3.0, both milliequivalents per liter, and requires admission to continue management of these chemotherapy-induced complications. You have 60 seconds to solve, and your time begins now. All right. So let's take a look at our inventory list. We have metastatic colon cancer, which is primary, and to the liver, which is our secondary. And then we have admitted for chemotherapy, developed severe nausea, vomiting, acute dehydration, IV fluid and ondansetron infusion, and then chemo-induced complications. So I'm going to just eliminate a couple things from this list just to make it a little bit more streamlined. I'm definitely getting rid of this chemo-induced complications because it's a little bit redundant. I have the complications listed up here, but then I'm just getting rid of this IV ondansetron infusion because we are really just listing our diagnoses and signs and symptoms. It is definitely important, but for our ICD-10-CM coding, I'm going to get rid of that. So the guideline that I used to help me solve this scenario was Chapter 2, E3. And this tells us for antineoplastic chemotherapy, you'll list first the Z51.11 and second the complications. So with that being said, we can eliminate B because this is listing a complication first. And we can also eliminate D for the same reason. It's listing the complication first. And we can eliminate C because it's listing the neoplasm first. And so that leaves us with A, which is Z5111, E86.0, R11.2, C18.9, C78.7. So this is the chemotherapy, dehydration, nausea, vomiting, and then these are our neoplasm codes. So we have the primary of the colon and then the secondary of the liver. All right, coders, I hope that helped you all and you guys all got it correct. And if you didn't, it's okay. I hope you learned something. And let's move on to the next one. Which diagnosis code should be sequenced as principal? A, Z51.11, B, C50.919, C, C78.2, D, J91.0. A 67-year-old female with known primary breast cancer is admitted for a thoracentesis to evaluate suspected pleural metastasis. During this admission, she also receives her scheduled chemotherapy treatment. You have 60 seconds to solve, and your time begins now. Okay, so let's take a look at our inventory list. We have primary breast cancer, admitted for thoracentesis, suspected pleural metastasis, and we have chemotherapy during admission. And just so you guys know, the thoracentesis, just like real base level is what it is. I'm definitely not a doctor, but it is a procedure that removes fluid from the pleural space, which is the area between the lungs and the chest wall. The pleural space is a fluid-filled cavity located between your lung and your chest wall. It's also known as the pleural cavity. Okay, so the guideline that I used to help me solve this scenario was Chapter 2, F. And this guideline states that when the RFE is to assess the extent of the malignancy, you sequence the malignancy first. So based off of that, sorry, got a little tickle. Based off of that, what are some of the options that you can eliminate on site? I'm going to eliminate options A because that's that chemo or radiation therapy code. And I'm also going to eliminate D because that's not even a neoplasm code. And we have B and C left here. And let's take a look at these codes. So we have C50.919, which is malignant neoplasm of unspecified site of unspecified female breast, which is definitely in line with our primary breast cancer. But we're going to eliminate it because the reason why is because this person is getting the thoracentesis to evaluate the suspected pleural metastasis. And I don't want to throw you guys all off, but if you look at this encounter, this person was admitted, which means that inpatient guidelines are applicable to this encounter. They are different than outpatient. So when you have inpatient, you can code for suspected, rule out, probable, any diagnoses that have those listed in the description of them. So this is a suspected pleural metastasis. So we're going to code the C78.2, which is the secondary malignant neoplasm of the pleura. And once again, that is because this patient is admitted. So it's different than outpatient coding. So the answer is C, C78.2. I hope that makes sense. Hopefully it didn't throw you off too much. But this is listed in your guidelines in the ICD-10-CM manual. Definitely recommend looking at the differences between the inpatient and the outpatient. But yeah, let's move on to the next one. What should be sequenced as the principal diagnosis? A, G89.3, B, R06.02, C, C34.90, D, R07.89. A 58-year-old male with known primary lung cancer presents to the emergency department with severe chest pain and shortness of breath related to his malignancy. The patient is admitted and treated with pain medication and supplemental oxygen. You have 60 seconds to solve, and your time begins now. Okay, let's take a look at our inventory list. And I put primary lung cancer, severe chest pain, and shortness of breath related to malignancy, admitted, treated with pain meds and supplemental oxygen. Okay, so the guideline that I used two actually, to help me with this scenario was Chapter 2G and Chapter 2H. So G states, do not code signs and symptoms if they are related to the malignancy. And H states that neoplasm related pain, you code first the G89.3, which is that neoplasm related pain code. And then second, you have the neoplasm. So with that being said, coders, this tells us exactly what our answer is going to be. So we are going to eliminate everything except for A, which is G89.3. All right, let's move on to the next one. Okay, which sequence of diagnosis codes is correct? A, G89.3, C40.20, C79.51, B, C40.20, C79.51, G89.3, C, C79.51, C40.20, G89.3, D, G89.3, C79.51, C40.20. A 72-year-old patient with stage 4 primary bone cancer of the femur is admitted specifically for pain control through adjustment of her pain medication regimen, as outpatient management was unsuccessful. The bone cancer has metastasized to multiple vertebrae, and the physician documents that the severe pain is due to the malignant neoplasm. You have 60 seconds to solve, and your time begins now. Okay. So now let's take a look at our inventory list. We have stage 4 primary bone cancer of the femur, admitted for pain control. The cancer has metastasized to multiple vertebrae and severe pain due to malignant neoplasm. And I'm going to reference again the chapter 2H, which we just referenced in the last scenario, which does tell us when the stated reason for the encounter is documented as pain control or management, which is what we have listed here, right? Admitted specifically for pain control. You list first that neoplasm related pain code and then second your malignancy. So with that being said, we can eliminate quite a few things, but we are going to eliminate B and C because they're both sequencing neoplasm codes first. And that leaves us with A and D. And as you can see here, we have some slight differences in our sequencing of the neoplasm codes. And so let's just take a look at those neoplasm codes real quick. So if you go to your neoplasm table and if you look at bone and then you go down to femur, you'll see right here it'll tell you if you have primary or secondary in situ and what codes are appropriate for this one. So we have the primary bone cancer of the femur. So we are going to go with C40.2, which is right here. C40.20, malignant neoplasm of long bones of unspecified lower limb. And then if you keep going down that list until you get to vertebra in the neoplasm table, you have your primary, your secondary. This tells us C79.51 is the malignancy code for secondary malignancy of the vertebra. So we are going to look at C79.51, which is secondary malignant neoplasm of the bone. So these definitely aligned with our encounter here. And so you may be wondering, well, which one do we sequence first? So just based off of this encounter and the information that we have here, it doesn't, specify if the pain, is related to the primary, the secondary, if she's there for back pain or leg pain or anything like that. So I just went with putting the primary first and then the secondary second for this scenario. So I chose A over B, or I'm sorry, A over D, because this is listing the primary malignancy for after, our neoplasm related pain. It has the primary and then it has the secondary. All right, coders, I hope you guys got that correct. And if you didn't, like Miss J says, I hope you learned something. And let's move on to the next one. Which sequence of diagnosis codes below is correct? A, C50.919, C79.31, B, C79.31, C50.919, C, Z51.0, C79.31, C50.919, D, Z51.0, C50.919, C79.31. A patient with primary breast cancer and metastasis to the brain is admitted specifically for gamma knife radiosurgery to treat 3 brain metastases. The primary breast cancer is stable and not receiving any treatment during this admission. You have 60 seconds to solve, and your time begins now. Okay, let's take a look at our inventory. We have primary breast cancer, metastasis to the brain, which means it's secondary. We have admitted, so inpatient guidelines are applicable here. And we have gamma knife radiosurgery for 3 brain metastasis. Primary cancer not receiving treatment during the admission. The guideline that I used to help me solve this scenario was Chapter 2, I2. And this states if the patient has primary and secondary cancer and treatment is for the secondary cancer, you list first the secondary cancer and second the primary. And as our encounter specifically states that the primary breast cancer is stable and isn't receiving any treatment during the admission. So based off of this, what can we eliminate on site? I would say we can eliminate C and D because this is sequencing our chemo codes first, and that doesn't align with our guideline. So we are going to get rid of C and D, which leaves us with A and B. And now, based off of kind of those little tips that we gave you, I bet you guys could also figure out which one of these 2 options is going to be the answer. But let's do our due diligence and look at C79.31, which is secondary malignant neoplasm of the brain, and C50.919, which is malignant neoplasm of unspecified site of unspecified female breast. So, our guideline here states that if the, whichever site is getting treated is going to be your first listed code, right? So we have our secondary site in this particular case that is getting treated, and our primary site is not getting treated, which means we are going to list the secondary site first and not the primary site. So B is going to be our answer because this is listing our secondary malignant neoplasm of the brain first. All right, I hope you guys got that correct, and let's move on to the last one. Which sequence of diagnosis codes is correct? A, C34.12, E86.0, B, E86.0, C34.12, C, Z51.89, C34.12, D, Z34.12, Z51.89. A patient with known primary lung cancer of the left upper lobe is admitted with severe dehydration requiring IV fluid replacement. The patient's lung cancer is stable and not being treated during this admission, but the physician documents that dehydration is due to the cancer. You have 60 seconds to solve, and your time begins now. Okay, let's take a look at our inventory list. We have primary lung cancer of the left upper lobe, admitted. So, once again, inpatient guidelines are applicable. Severe dehydration, cancer not being treated during this admission, and dehydration is due to cancer. The guideline that I used to help me solve this scenario was Chapter 2, I4. And this guideline states when you have neoplasm related complications, you're going to sequence first your complication and second the malignancy. And so that is if the RFE is the complication, except when the complication is anemia. Anemia is different, it's opposite. So just keep that in mind. So you could probably eliminate quite a few things here on site based off of that, but let's take a look at this C34.12 code, which is malignant neoplasm of upper lobe, left bronchus, or lung. We like this code, but it is the malignancy code, so we are not going to sequence it first. So we are going to eliminate A and D because it's sequencing it first. And so now we have just B and C left. And C is sequencing this Z51.89 code first, which isn't our complication. And I don't think I snipped it, but the E86.0 is dehydration. So, but we're going to eliminate C and we're going to keep B, which is dehydration, and then our malignancy code here. All right. Thank you all so much for being here with us. I hope you guys are getting the hang of this and reading your guidelines and bringing your attention to all the sequencing orders that are listed in the guidelines. And I will see you all next week.
Okay, thank you so much, Miss Bianca. You all have done an amazing job, coders. How do you feel? You feeling good? Well, you should. I see a lot of light bulbs going off in the chat. Now it's time to talk about this homework. All right, so what do? If this is your first time, there are a lot of people jumping in right now, and it's okay because you can work at your own pace. You just can't work ahead of us. All right, coders. So if you want to know where the assignments are, go to www.amcicoding.com and click on YouTube course. Then scroll down until you see the syllabus. But if you are new to medical coding, then this is too advanced. You're going to have to scroll up and look at the prerequisites. We have some options for you. Now, after you click on the syllabus, we are now at week 3. All right. So if you need to look at the preferred books, go ahead and do that. But this is where we are, week 3. Number 1, this is what you'll need to do. If you want to watch the playback, it's good to have the PowerPoint playback handout and follow along if you want to. If you're in the Discord, go to the Discord and download the handout. Number 2, go ahead and watch the playback. 3, review the official ICD-10-CM guidelines if you don't have it and you prefer. You can look at the guidelines from the CMS document. This is the official guidelines. Click this link. Number 4, if you'd like, you can look at the guidelines and the sequencing order from your MCG manual. Number 5, go ahead and read your bucks. Yes, read bucks because bucks has the guidelines preceding the reading. So you can bypass everything. You can read the guidelines in your bucks manual. They just don't have the sequencing order like the AMCI MCG manual. So go ahead and do that and read all of the assignments. They kind of clump a lot together, so just make sure you click on neoplasms and you've got to, don't forget to do the quick checks. I think there is a coding shot for you to reference to practice using the neoplasm chart. You've got some exercises 5.3 and I believe 5.4. And your answers are in Appendix B of your Bucks manual. Then number 6, go ahead and watch YouTube lectures. Yes, we break down, I think, more of the guidelines here. So there's a part 1 and part 2, and it's in your playlist. Then Watch the MCG TAP lecture. This is how you get to the TAP lecture. You go to your MCG manual, and I believe it's in your table of contents, your first or second um, link, the first or second option, click on it. And when you click on it, you'll see the option to click on the TAP lectures. And this is what you get. And let me get my little pointer. As you can see, you've got this TAP lecture. It's going to show you how to annotate your ICD-10-CM manual, and it's an additional instruction. So check it out. And number 8, if you are in the Discord, there's some practice questions. I think there's like 15 practice questions. Go ahead and solve them. Please do not hand them in. And if you purchased the optional Bucks workbook, go ahead and do those corresponding practice exercises for Chapter 2, Neoplasms. Now, we don't have the answer key because this is not a requirement of our course, but it's an option if you have it. Okay, some people are, you know, having difficulty getting or logging into Discord. If you're unable to log into Discord, contact us at Student Success. That's contact at amcicoding.com. All right, so once you land in Discord, you'll come to your welcome page. Read the welcome, follow the instructions. After you are in, you should be able to see options on the left, and you can find your resources here. This is for extra resources. You can find it here. Announcements, check out the announcements, good announcements. Also, if you want to chat with your peers, you can chat here at the Coding Chat Lounge. And if you have a question for your instructor, ask it here. Okay. Also, if it's confusing to you, make sure that you look up top because that top bar will always guide you. Oh, one other thing. If you have a question about a lecture, and some of the lectures are older, but most have good information. So if there's something outdated, just respond at the bottom of that lecture. Or first, make sure you look in the description to see if there's a errata explaining the correct answer. If not, go ahead and put your question in. We'll get to it as soon as we can. All right. So, on that note, I want to say so long. Don't forget to complete the survey. Your responses help us so much. It helps us help you too. And the survey link is in the chat, so go ahead and complete the survey at your convenience. If you do it now while it's fresh, that is always best. Okay, thank you in advance. And speaking of thank you, as we close out class tonight, I want to honor my team, the AMCI team. They are the heart behind everything we do. Their passion, expertise, and unwavering commitment is priceless. So thank you, team. Thank you, interns. You are the best. And thank you to coders. Remember, this journey won't always be easy, but you are capable. You are strong and meant to succeed. Believe it, coders. So stay committed. Go study, practice, and go be great. And we'll see you next time.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around the world. AMCI. see.